Doctor of Nurses Practice is a program that was established 5 or 6 years back, and it's really to prepare nurses as doctorally prepared nurse practitioners, as well as preparing postmasters, nurses, and nurse executives in doctorally prepared advanced nurse leader roles.
Before coming into nursing, I was in the military. I was a research physicist in the military, and I spent 4 years doing a lot of leadership training. And when I came to nursing, I knew that I would pursue a leadership role at some point. And so the DNP offers that sort of advanced learning in that field. You know, right now I'm taking a class that's predominantly about transformational leadership. And these are some of the skills that we talked about when I was in the military, but now I'm starting to learn how to apply them to, you know, what I really want to do and where I want to go. And when we're sort of on this great forefront of huge healthcare changes, and we're sitting in a classroom learning about, you know, how it's been for years and years, and we sit around the table with people with, you know, backgrounds from many different places. And, you know, I think that we're going to go out and we're going to have such a different perspective and such a different view of sort of outside of the box thinking about different ways to handle these problems.
I had childhood epilepsy, and I got hit by a car and was in the hospital for a whole year. I broke my neck. So that really directed me more towards nursing. I'd always wanted to do it, but seeing the care that nurses gave really inspired me to become a nurse. And I grew up kind of poor, so I wanted a way to give back. I'm hoping first to get some good training, because just because you've graduated, I won't at all feel proficient as a nurse practitioner. I may even apply. There's a residency program, one of the few in the country, is in Worcester here at Family Health. But eventually I would like to work part-time here and definitely invest in some global health opportunities.
We are immersed in a medical school as well as an academic health science center. So we have the opportunity to be educators and learn from each other from the perspective of an interprofessional atmosphere, medical students, basic scientists, as well as our sister campus of our hospital and community system at UMass Memorial. We're actually a small school, so we can actually give a lot of attention to our students. We train our students to graduate as doctors of nursing practice, so they can go out into healthcare systems, whether they be acute or community settings, to be leaders, to affect practice change, to provide direct care and education, and to be part of a team that's helping both patient and family.